IgA nephropathy, also known as Berger's disease, is an autoimmune disease that affects the kidneys. It is caused by the abnormal production of the antibody IgA, which then builds up in the kidney filters, causing inflammation and damage. This can lead to permanent scarring in the kidneys over time, and potentially result in end-stage kidney disease, where dialysis or a kidney transplant may be needed. IgA nephropathy is relatively rare, with only about 200,000 people in the US being affected. While it can occur at any age, symptoms typically appear before the age of 40. In IgA nephropathy, your body's immune system mistakenly produces antibodies that target a specific type of IgA in your blood. These antibodies form clumps that get stuck in your kidney's filtration system, causing damage. The exact cause of IgA nephropathy is unknown, but it's not contagious and is influenced by genetic factors. Certain triggers, such as liver diseases, celiac disease, and infections like HIV, may play a role in setting off IgA nephropathy. It's not common for people with IgA nephropathy to have a family history of kidney disease. Instead, it's more likely that they have a family history of immune system-related diseases. IgA nephropathy can occur at any age, but it's more common in individuals between the ages of 13 and 40, and it affects nearly twice as many men as women. It's also more prevalent in people of Asian or white descent and rare in those with African heritage. The most common sign of IgA nephropathy is finding protein or blood in your urine. You may notice that your urine looks tea-colored due to the presence of blood, or you may only detect it through a lab test or chemical analysis. If there is protein in your urine, it may appear foamy. Some people with IgA nephropathy may not experience any symptoms for many years. However, in addition to blood or protein in the urine, you may also notice swelling in the ankles, high blood pressure, hypertension. In rare cases, the urine may contain a large amount of blood, giving it a red appearance. If left untreated, IgA nephropathy can lead to complications such as high blood pressure, sudden kidney failure, gradual loss of kidney function, chronic kidney failure, nephrotic syndrome, which includes symptoms like high protein in the urine, swelling, and high cholesterol, heart or cardiovascular problems. So, even though symptoms may show up in your urine, a blood or urine test isn't enough to diagnose IgA nephropathy. Your doctor will need to perform a kidney biopsy to confirm the diagnosis. This involves removing a small sample of tissue from your kidney using a biopsy needle. The doctor will numb the area and may even sedate you for the procedure. They will use imaging, such as a CT scan, to guide the needle to the correct spot. The sample will be sent to a pathologist who will examine it under a microscope to see if IgA has built up in your kidney tissue and assess the amount of damage. This biopsy is crucial for confirming the diagnosis and determining the most appropriate treatment. After a diagnosis of IgA nephropathy, your doctor may recommend periodic testing to monitor your kidney function. This can involve blood and urine tests to check for issues such as anemia, bone disease, heart and blood vessel disease, and acidosis. At the age of 30, I was diagnosed with IgA nephropathy after a routine physical. My doctor noticed high levels of protein in my urine and referred me to a kidney specialist. The specialist suspected IgA nephropathy but needed a biopsy to confirm. I initially decided against the biopsy, but as my symptoms worsened, I eventually underwent the procedure and started treatment with blood pressure medication and prednisone. After experiencing a flare-up and dealing with the side effects of prednisone, I found a specialist dedicated to IgA nephropathy and entered a drug trial. Although I saw positive results, I later contracted COVID, leading to the need for a kidney transplant. Now, a year after the transplant, my health is stable and I'm heavily involved with the IgA Nephropathy Foundation, helping others navigate clinical trials and advocating for the community. When you visit your doctor, it's important to be prepared. Make a list of all your symptoms and how long you've been experiencing them. Also, write down all the medications and supplements you're currently taking, including the dosage. During your visit, gather as much information as you can about your condition and how to manage it. It may be helpful to bring a trusted friend or loved one with you to take notes and help you remember important details. You can ask your doctor questions such as, "How advanced is my condition? What medications do you recommend?" Should I eat a special diet? What symptoms should I be on the lookout for? How often will I have blood and urine tests? What kinds of doctors should I see? Do I need a kidney transplant, or might I need one in the future? What other lifestyle changes can I make to take care of myself? How might my other health conditions affect my IgA nephropathy? What is the best way to get in touch with you if I have a question? Where can I look for more information about my disease? Are there any clinical trials available? Your doctor will also have questions for you, such as: do your symptoms happen all the time or only occasionally? How severe are your symptoms? Does anything seem to improve your symptoms? Does anything make your symptoms worse? Unfortunately, there is currently no cure for IgA nephropathy, and the scars it causes on the kidneys are permanent. Doctors are unable to treat or remove these scars. However, there are medications available that can help slow down the progression of the disease and manage its symptoms. These medications can help in the following ways. Reduce the amount of protein in your urine. One specific medication, sparsentan, Filspari, can be used to block certain receptors and reduce proteinuria in adults with primary immunoglobulin A nephropathy. Control high blood pressure. Medications like ACE inhibitors and ARBs can help manage high blood pressure, protect your heart health, and slow down the progression of kidney disease. In some cases, additional medications like beta blockers or calcium channel blockers may be needed. Remove excess fluid from your blood. Diuretics can help remove extra fluid from your blood when your kidneys are not able to do so effectively due to damage. Manage inflammation in your kidneys. Steroid medications like prednisone or drugs that suppress the immune system like cyclophosphamide may be prescribed to help reduce inflammation. It's important to note that the benefits of these medications compared to the risks are not entirely clear, and not everyone may be eligible for them. Lower high cholesterol. Statin medications can help keep cholesterol levels in check, which tend to be higher in individuals with IgA nephropathy. Now, let's talk about what you can do at home to help boost your kidney health. First, consider taking omega-3 fatty acids, which can be found in fish oil supplements or by eating fish. These healthy fats may help reduce inflammation in the glomeruli without causing harmful side effects. Just be sure to talk to your doctor before starting any new supplements. Next, it's important to keep your blood pressure in check. Following your doctor's prescribed medications and making lifestyle changes, such as reducing salt intake, avoiding excess alcohol, losing weight, and exercising regularly, can help maintain a healthy blood pressure. Additionally, it's a good idea to eat less protein, as too much protein can strain your kidneys. However, be sure to consult with your doctor or a nutritionist before making any drastic changes to your diet. Cutting back on salt is also important, as it can increase blood pressure and cause more protein to spill into the urine. Furthermore, be cautious about the medications you take. Some over-the-counter and prescription medications can be harmful to your kidneys, so always consult with your doctor before starting any new medication. And of course, it's crucial to avoid smoking, as it can slow down blood flow to your kidneys and affect the effectiveness of your blood pressure medications. Lastly, make sure to drink the right amount of water to help your body function properly, but always consult with your doctor about how much is too much. There are different ways that IgA nephropathy can progress, such as: it can go away completely, which is more common in kids. The kidneys may slowly lose function and require monitoring. The kidneys may stay the same for many years and only need regular checkups. In some cases, kidney failure may occur, which would require dialysis or a kidney transplant. Your treatment and outlook will depend on various factors, including your age, your overall health and medical history, the amount of protein in your urine, as more protein indicates the disease may be worsening, your kidney's filtration rate, also known as glomerular filtration rate, GFR, the findings from your biopsy, including the extent of scarring, how well you respond to specific medications, procedures, or therapies. Research has shown that 20% to 40% of individuals with IgA nephropathy will develop end-stage renal disease, ESRD, within 20 years and will require dialysis or a kidney transplant. However, it's important to note that many people with IgA nephropathy do not experience this. If you're looking for support and information about IgA nephropathy, there are resources available both online and in person that can help you feel less alone. Some of these organizations include National Kidney Foundation, which offers a national telephone-based peer support program called NKF Peers Group. National Institute of Diabetes and Digestive and Kidney Diseases, which provides educational information about IgA and has a community health and outreach section. IgA Nephropathy Foundation, a non-profit public health organization that funds research about IgA nephropathy. Your doctor may also be able to connect you with in-person support groups in your local area. Living with a chronic condition like IgA nephropathy can be tough on your mental health. Remember, your physical and mental well-being are connected. Here are some things you can do to take care of your emotional health while managing your illness. Speak up for yourself. Don't be afraid to ask questions or express your concerns. Make sure your healthcare team listens to you and that you feel comfortable with them. Seek support. Consider talking to a professional about your feelings and challenges. You can find a counselor through your insurance or ask your doctor for recommendations. Make time for joy. Engage in activities that bring you happiness and fulfillment. Manage stress. Try practicing relaxation techniques like yoga, meditation, or deep breathing to help calm your mind and body. Stay on top of your care. Don't skip appointments and keep track of your symptoms so you can actively participate in your treatment. Your medical team for IgA nephropathy may include primary care doctor. They may first diagnose you and monitor your health as you treat your IgA nephropathy. They may also refer you to specialists. Nephrologist, these specialists treat kidney disorders and diseases and can provide careful monitoring of your disease. Nutritionist or dietitian, your doctor may recommend a low-salt diet to reduce stress on your kidneys and heart, and a nutritionist or dietitian can help you adjust your meals accordingly.